I'm pleased to introduce the CEO of My Senior Health Plan, Mr. Peter Blasi. Peter, the floor is yours.
Thank you, Will, and good afternoon to all of our attendees. And thank you, Calco's Credit Union, for putting this informative information together and inviting us to present. My name is Pete Blasi. I'm the president and CEO of My Senior Health Plan. For the past 20 years, we've been assisting San Diegans and beyond with their Medicare and their Medicare questions. Our quest is to make sure that Medicare recipients are given transparency in their options of Medicare, to make sure that it's very basic and informative to them, and make sure that they have an unbiased type of resource in My Senior Health Plan. We've been assisting San Diego for a long time, and we are beyond San Diego. We're licensed in all the different states, and we're very proud of it, assisting thousands of Medicare recipients throughout the country. Today, we have a lot of information for you, and I'm very excited to be presenting Jacqueline Nudo as your presenter today. We'll be going over Medicare under 101, and there's going to be a little bit of housekeeping information for you as well. Just a bit of our housekeeping information is this webinar is being recorded. All attendees are muted. A copy of the slide, which is very informative, and the top 10 frequently answered questions or asked questions will be shared. You could submit questions in the Q&A box. We want it to be a very fun and interactive process for the attendees. These webinars are hosted monthly, so definitely tell a friend about these webinars. And this is just the beginning. You could actually schedule an appointment and really get your questions answered after the webinar. Compliance and privacy is of the utmost concern. We want to make sure that we give independent advice, and we're not affiliated with Medicare or the U.S. government. So you could submit your Q&A questions, and it will remain confidential. Again, I'm very excited to be introducing Jacqueline Nudo. Jacqueline has been a part of our organization for quite a long time, nearly a decade, and she's been assisting the Medicare beneficiaries throughout the United States for that time as well. She's assisted thousands of Medicare recipients in very complex situations. If you're coming off a group program, if you want to see if you're Medicaid eligible, or if you're eligible for subsidies and beyond. So we're very, very excited to be presenting Jacqueline Nudo as your presenter today. So a little bit more about My Senior Health Plan. So we've been assisting Medicare beneficiaries since 2005, and as a guide and a trusted resource that comes with no cost for our services. We really pride ourselves on being independent and giving unbiased support. These plans could be complex, and we're here to sort it out for you. We're here to be in your corner and to make sure that you're on the most beneficial plan that fits your needs, your doctors, your prescriptions, that really enhances your life. And we want to make it simple. Medicare can be complex and overwhelming, but we really break it down to make sure that you understand Medicare and what type of plan you may be enrolling in. And ongoing support, that's where we really shine. Post-enrollment support is very important to us. We want to make sure that if you enroll into a plan, that you could give us a call and get your questions answered. That's very, very important to us. So we have a whole group of professionals that are committed to this cause to make sure that your plan is working for you. So that is our commitment to excellence to you. So we are proud to walk along the Medicare community, and we do this a number of different ways. We are we've been featured on Senior Style, and you might see me there about talking about Medicare and some of the challenges that's affecting our community in San Diego and California and even nationally. We are involved in community events like the Walk to End Alzheimer's and Senior Tech Connect to make sure that seniors are educated to make sure that they understand how to use technology. We are very proud to be a partner of the BBB Torch Awards for Ethics, and we've been nominated as one of the most ethical businesses in California or in San Diego, and hopefully next year, California and beyond. And we've been, like I said, featured in on Channel 5, ABC, and just very proud to be part of the community and proud what we do at no cost. So without further ado, I am going to give you this little bit of a commercial about us, and then we'll get on our way about Medicare 101. I'm Pete Blassie, President and CEO of MySeniorHealthPlan.com. For over 20 years, we've been a trusted source of unbiased advice for the Medicare eligible community. Our experienced, professional, and licensed staff are dedicated to helping you navigate the process of finding the right Medicare insurance plan. Our service is offered at no additional cost, and we are licensed nationwide. Book an appointment with us today by visiting MySeniorHealthPlan.com or call us toll-free at 877-255-6273. We're here to serve you. Thank you for that. Again, we're really excited to be presenting this Medicare 101. We want to make it fun and interactive. Jacqueline's going to take some questions at the end, so we're very, very proud about that. A little bit about Jacqueline again. She's been working with Medicare clients for quite a long time, nearly a decade. She loves traveling, has a global perspective and from living overseas and traveling and experiencing different cultures and really getting into healthy living and different aging practices and discovering fresh and different ideas. So she's just a joy to work with and speak to. And if you have the opportunities to speak with Jacqueline, you could ask her about her recent trip to Japan. So again, without further ado, Jacqueline Nudo is going to be your presenter. Thank you, Jacqueline.
Good afternoon, everybody. And I hope everyone had a wonderful Thanksgiving. I'm still stuffed from Thursday. So we'll be getting into Medicare here. Pete said, I've been with the company for nearly 10 years now. And one of my favorite things to do with my position is help people understand their current situation and what their options are for the future and get over their general fear of speaking with a consultant because it can be a little bit frightening. We do have a Q&A towards the end of this webinar, and I'll be happy to help answer any more specific questions about your situation. So we'll be going over a few things today, like what is Medicare? How is Medicare administered? Who's eligible for Medicare? How much does it cost? How do you fill in the gaps that Medicare Part A and Part B have? And of course, when can I enroll in Medicare? So what is Medicare exactly? Well, Medicare is federal health insurance, and it was a program created in 1965 specifically for individuals age 65 and over. So a little fun fact, it was $3 per month for Part B when it first was created in 1966. And of course, as with everything, that price has significantly increased, and it's set to be $206.50 in 2026. And President and First Lady Truman were actually the first Medicare beneficiaries. So let's start off with who is eligible for Medicare. So again, Part A and Part B are federal government health insurance, and it was initially created for those who are 65 years and older. but now it does include those who have certain disabilities and are not yet 65. For example, if you've got end-stage renal disease or if you've got Lou Gehrig's disease, you can qualify for Medicare well before you've turned 65. So here's our poll questions to get to know our audience a little bit better today. So we do have a few questions here, again, just to get a better understanding of where you're at on your Medicare journey and what you needed help with specifically. And there are 3 questions total here. And we'll just give everyone a little bit more time to answer these questions. Okay, so for the first question, which of the following describes your current relationship with Medicare? Looks like a big portion of the group today will be turning 65 soon and have questions. Looks like another portion is already on Medicare, and this is the perfect time to ask questions. We're in the annual enrollment period. Let's see here. When should I enroll in Medicare seems to be one of the top questions, and we are going to cover that. Very good question. And what does Medicare cover? It can get very confusing, so we're definitely going to touch on all of these later today. And what are your thoughts on your current coverage? So it looks like a good portion of you are actually happy with your current coverage. Maybe you're wanting to know if you can have something comparable when you do turn 65. And then another big portion needs help understanding your current benefits. Very common, so we'll get into that as well. All right, so first let's talk about original Medicare, which is that Part A and Part B, and how is it administered? So again, Part A and Part B, which is federal government health insurance, covers inpatient hospitalization and outpatient or medical services. Part A specifically is for inpatient hospitalization, and Part B is for medical services like your doctor visits, tests and diagnostic procedures, and also outpatient procedures. Inpatient would cover things like a semi-private room, hospital meals while you're an inpatient, drug and medical supplies while you're inpatient, also lab tests, x-rays, radiation treatments that you might need while you're hospitalized, as well as rehabilitation services and therapy once you've been released. Hospice care also falls under Part A. So Part B, this would be more like your regular doctor visits, your specialists, your test and diagnostic procedures. If you needed to go to an emergency room, urgent care, those sorts of things are all falling under Part B of Medicare. Now remember, Part A and Part B is federal government health insurance, and that's administered through the federal government, or specifically Social Security. And the secondary insurance, that's administered through private insurance companies and brokers like ourselves. Okay, so we got this question done. So let's understand the costs of Medicare and what you need to know a little bit more about. Now, oftentimes, people think that Medicare is 100% coverage, and unfortunately, it is not. So for Part A, it does cost $0 per month as long as you've worked at least 10 years total. You've probably noticed that you've been paying into Medicare taxes throughout your years of employment. All of that goes through Part A. And although it does cost $0 per month, you are going to have out-of-pocket costs. For example, you've got this very large deductible of $1,716. And that's not an annual deductible, that's actually per benefit period. Now, for Part B, it doesn't matter how many years you've worked. Part B has a monthly premium. Next year, it is set to be $206.50. After you've paid that premium, you've still got this annual deductible of $288, and then you've got this unlimited 20% coinsurance for all medical services. And oftentimes that's what you hear the most when you're learning about Medicare, is that 80-20% split. That 80-20% split is for medical services, outpatient services, not for inpatient hospitalization. And unfortunately, there's no stop loss to that 20%. So no matter how expensive your medical bills are, you are going to have to pay 20%. Now, we're often used to having certain coverages in, like, let's say our employer coverage, hearing tests, routine eye care, most dental, routine foot care, and foreign travel. Unfortunately, none of these things are covered by original Medicare Part A and Part B. So we did go over this poll question as well. Now, how do you fill in the gaps that Part A and Part B have so you can have more comprehensive coverage? Well, that's where we come in. So there are different types of secondary insurance. You can have the traditional route, which is Medicare supplement plans. These are also known as Medigap plans, and these are administered through private insurance companies. Now, usually we're used to thinking in terms of only HMO and PPO for our health insurance, but Medicare supplement plans are neither, although they do mistakenly get called PPOs all the time. These help you fill in those gaps that Part A and Part B have, like the hospitalization deductible and the medical 20% coinsurance. They don't, however, cover prescriptions. Now, you can use these across the country at any doctor's office as long as your providers say, yes, we take Medicare. And when you first turn 65, you don't actually have to go through medical underwriting in order to apply and qualify for one of these Medigap policies. Now, since Medigap plans do not cover prescriptions, we pair them with a standalone prescription drug plan, which is also known as Part D of Medicare. And these are also administered through private insurance companies. They don't cover hospital or medical copays or deductibles or coinsurances. They just cover prescriptions, which is why they get paired with a Medicare supplement plan so that you get that comprehensive hospital, medical, and prescription coverage. But they are two separate policies. Now, the other option is called a Medicare Advantage plan. These are known as Part C of Medicare, and they're much more similar to HMOs and PPOs from, like, let's say, employer policies or Affordable Care Act plans. And these will actually combine your hospital and medical, so your Part A and Part B, and your prescription coverage, which is Part D, all rolled into one policy. And just like supplement plans and drug plans, Part C policies are also administered through private insurance companies. And these can include additional benefits that aren't typically covered by Medicare, like routine vision, routine dental, even fitness benefits. And these, again, are meant to help you reduce those Part A and Part B deductibles, copays, and coinsurances. So potential benefits of Medicare Advantage plans, again, include routine dental, routine hearing, routine podiatry visits. Those are things like helping trim your toenails or removing corns or calluses. Sometimes foreign travel is included, as well as fitness benefits, an over-the-counter allowance, routine chiropractic care, and even transportation. Now, of course, these benefits will vary from plan to plan, but this is just a general idea of the types of benefits you can get from Advantage plans. So one thing to note is that Medicare options vary, not just from state to state, but also from county to county. Now, what we have here in Southern California may not be available in Northern California or in neighboring states like Arizona, for example. Pricing can also vary from area to area. Medical groups can vary from area to area. And of course, plan benefits, like all of those fun extras that we saw in the last slide. So a lot of you had questions about when should you be signing up for Medicare. So let's address that. Now, when you think about signing up for Medicare, you have to think of enrollment into original Medicare, Part A and Part B, and secondary insurance, the supplement plans, drug plans, and advantage plans as two separate things. So your time frame to enroll into original Medicare, Part A and Part B, is around your 65th birthday, usually 65th birthday. You've actually got 3 months before your 65th birthday month, the month of, and another 3 months after. This window is called the initial enrollment period. It's a 7-month window. If you miss that period, you've got another opportunity. It's the first quarter of every year, runs from January 1st through March 31st. This is called the general enrollment period. So if you missed your 65th birthday, that's your window to then enroll into Part A and Part B. Or if you qualify for like a life-changing event, you can enroll through what's called a special enrollment period throughout the year. You don't have to be in your IEP or in GEP. Common special election periods would be loss of employer coverage. When you retire and lose employer coverage, that's usually a good time to start enrolling into your Medicare Part A and Part B. Now, for secondary insurance, you're going to have similar enrollment windows. Secondary insurance, again, are for supplement plans, drug plans, and advantage plans. Your 65th birthday, another 7-month window. You've got the annual enrollment period each year, which we're in right now. That happens every year from October 15th through December 7th. You've got open enrollment period, which happens to overlap with the GEP, but they are two separate windows. And then, of course, life-changing events like losing employer coverage, for example, would qualify you for enrollment throughout the year. And then you've got what's called the Medicare Advantage or Medigap open enrollment period, which is 6 months from when you first start your Part B. So all of these timeframes are for you to enroll into secondary insurance. And do you necessarily have to memorize all this? Not at all. That's what we're here for. So just tell us what you're trying to accomplish and we'll tell you when you can do those things. So again, common special election periods, think of these as life-changing events. Retiring, loss of coverage from an employer or a spouse's coverage, very common one. Maybe you have another chance to get coverage. For example, you gain or lose financial assistance like Medi-Cal from the state. Maybe you're moving. That's another very common one. You move from one state to another after retirement. That's also one of those life-changing events. But there are several more. These are just some common ones. For those who have both Medicare and Medi-Cal, there are policies called dual special needs that allow you to enroll throughout the year. That's another election period, or think of it as a life-changing event. And then a lesser known one would be for those with chronic conditions, like let's say diabetes, for example. There are policies tailored for those with specific chronic conditions, and that does count as one of these special election periods that allow you to enroll into coverage throughout the year. So the most important time to memorize would be around your 65th birthday, which is called your initial enrollment period. And it is a 7-month window. And that can be used to enroll into Part A and Part B, original Medicare, as well as your secondary insurance. So a little bit about what you can expect. First, we help you determine your enrollment needs. We'll walk you through enrolling into Part A and Part B, and from there, you'll get your Medicare ID card from Social Security. Some people actually do get auto-enrolled, so we have that discussion with you to help you sort that out. Some people don't even need to enroll, for example, if you're still working and have insurance through your employer. And you can enroll for Medicare online, in person at your local office, or over the phone. And again, this is federal government, so it is done through Social Security. Now, generally, Social Security asks that you give them about 45 days to process your application. Sometimes it does take a little bit longer than that, but typically 45 days to receive your ID card. Now, you don't necessarily have to wait for your physical card to deliver to start figuring out what you should be doing for secondary insurance. We can go over those options even before you've enrolled into Part A and Part B. We'll help you with enrollment and, of course, post-enrollment support as well. Now, the reason why we recommend that you don't necessarily wait for your physical ID is because it might take you some time to make a decision or to digest all the information out there. And of course, this is rarely a one and done thing. So even after we have helped you enroll, we have ongoing guidance. And during your enrollment process, we're there to help you narrow down your options, determine the correct effective date for your situation, because not everybody has the same situation. You might be retiring down the road, for example, and of course, we'll help facilitate your enrollment. So here's a little bit about what to expect when you initially reach us. So we'll start with an initial assessment. Again, not everybody necessarily needs Medicare when they turn 65, so we'll help you figure that out first. You may not even need our services. And from there, we'll go over your prescriptions and your doctors. Oftentimes, people are very concerned about keeping their current providers and their medical groups. We only want to recommend policies that help you keep your current doctors and will cover your prescriptions at the lowest rate. So from there, we'll go over plan options. Again, there's Advantage plans, supplement plans, and drug plans, which can vary from county to county. We'll give you a personalized overview, let you know what the pros and cons are of going a particular route. And then once you have enrolled, again, this is rarely a one and done thing. We'll help you with ongoing enrollment support if you've got basic questions like customer service, if you need a policy review, if you've got one of those life-changing events like you're moving to a different area, we're there to help down the road. So Medicare can be very confusing. If you feel confused, you're certainly not alone. So here's some questions we get on a daily basis. What exactly is extra help? Do I need to enroll in a Medicare Advantage plan specifically? What do Medicare supplement plans do? Am I going to be forced to change doctors? Does original Medicare offer prescription drugs? Does Medicare cover foreign travel? And why can't Social Security just give me everything I need? So again, if you've got these questions swirling in your head, you are definitely not alone. So why work with us? Now, we're local here in San Diego, but we're also licensed in all 50 states. Again, we are giving you personalized professional guidance, and we're the first to tell you if you don't even need our services. We've got well-educated professionals, and we're dedicated to delivering customized individual help and engagement pre and post-enrollment. We work with most carriers, but we do give you unbiased and transparent advice. Again, if you don't need our services, we want to be the first to tell you that. Insurance carriers may not inform you of when their plans become non-competitive, but because we're a brokerage, we can tell you that. Medicare plans change annually, and our experts keep you informed about these options from year to year. And we always want to ensure that you have the most competitive coverage, not just when you initially enroll, but down the road as well. We are a trusted advisor. Our services are completely free. And from education to enrollment and lifetime support, you'll never pay a dime for our expert assistance. So I'll pass this back to Pete, and he'll go over a little bit about our reviews.
Thank you so much, Jackie. That was really informative. What we're most proud about is some of our comments that our clients have been saying about us. This is really, really important to us, and I think our community as well. In understanding Medicare, it's so complex, and we really try to break it down and make sure that everybody is is heard and making sure that they understand Medicare. Every situation is different. People have particular doctors they want. There's particular prescriptions that are needed, care coordination, or is there is there a subsidy that's available? And there's lots of different types of subsidies, and Jackie could speak to all of those. And the rest of our staff is amazing as well. So our quest, and everybody that's on our team, is the quest to help. We want to help our community, and we have that common goal. These are some of our love letters that we receive, and through the years, they used to come in paper, and now they come digitally. But we're very, very proud of them. So when we reach out to you, it's there's when should you reach out to My Senior Health Plan? So there's a number of times people reach out to us. So obviously, when you start to become eligible for Medicare, which is at 65 or 64 and 9 months to be exact, you should receive your Medicare card. So we call that the initial enrollment period. And we have a number of people that are attending this webinar that are approaching that enrollment period. And Medicare could be overwhelming because there's a lot to do with Medicare and what plan you should be on. And so many people think, well, I'll just go on my neighbor's plan. But I'll tell you, every plan is different. Everybody's needs are different, and what's great for your neighbor uh, could be disastrous, we say, for yourself. So we want to make sure that you are on a plan that really fits your lifestyle. So there's also life changes. So if you're still working or coming off a group program, this is another, what we call it, a special election that we would want to evaluate if it makes sense to go on to original Medicare or stay where you're at. There's a lot to consider there. And moreover, after enrolling in one of these plans, you want to review your plan year over year. We happen to be in the last week of the annual enrollment period, which is we call AEP, where it runs from October 15th through December 7th. So during this plan, is a time to review especially your Medicare Advantage programs and your prescription drug programs. So we want to make sure that you review these programs and during this period of time. Moreover, your prescription drug. So these drug programs change from year to year, and your needs change from year to year. So this is the time to review those. Technically, these Medicare Advantage programs, these prescription drug programs, they run 1 year. So, and they just roll into another year. And if you have any questions and concerns, that you'd always want to reach out to us. So yes. So this is our QR code. If you'd like to schedule an appointment right onto Jackie's calendar, she does have some time slots left. This is a time where you can, you could do that. You'll receive a Calendly link through Zoom, and you could click on that and walk through it. If you have a question on how to do that, you could always chat back to Nicole here. She's live on the chat to assist. We also have a toll-free number that you can call in and schedule an appointment, or speak to a representative as well, and an email, of course. To learn more about My Senior Health Plan, you can go to myseniorhealthplan.com and learn more about us and get a general overview of Medicare. There's a lot of information there. So we also have multilingual support. If some of our community speaks Spanish, Chinese, Korean, to name a few, we could assist. Just let us know, and we have licensed representatives ready to go, that are licensed and ready to assist and walk you through the programs for you. I want to reiterate, we are licensed nationwide in every state. So we have access to those plans, and we could walk you through those plans. And technically, if you leave the county, there's another set of plans. So you definitely want to speak to us, even if you just leave the county. We're going to go through some questions and answers, and we're a guide to take you every step of the way. when it comes to Medicare.
Great. Thank you, Pete. Hi, everyone. My name is Nicole Medina, and I oversee the marketing department internally here for my senior health plan. I'm excited to help with the Q&A. But quickly, Pete, I would love for you just to chat about a letter that goes out every single year that some of these individuals on this webinar may not know about, called the ANOC letter. Can you give them some information regarding that?
Yeah. So every year, if you're on a Medicare Advantage program or on a prescription drug program, you'll get an ANOC letter, which is the Annual Notice of Change. And this letter is required by each insurance company to tell you a bit about the benefits coming up for the following year. So those that are already on a Medicare Advantage or prescription drug program should have already received this ANOC letter. So for many people in the San Diego area and beyond, there's been a big shift away from the PPOs, and many plans are terminating, and they may say your plan is no longer available, or there may be a premium, or that maybe the co-payments went up if you reviewed it closely. In any of those scenarios, you may want to make an appointment with us to go through your current plan, if it's available, and then see if another plan may be more applicable for you. So that is through this ANOC letter, gives you a lot of information. A lot of people just throw it to the side, and it's something I got from my insurance company, and I guess I'll deal with it next year. If you deal with it next year, you may find yourself, without a plan come January 1st. And then if we don't get you effective on a plan, you would have to wait through January to get you effective in February. So I definitely want to make sure that you're on the most applicable plan for 2026 by giving us a call or scheduling an appointment.
Great. Thank you, Pete. I'm so glad we went over that. That's a really important aspect of our Medicare plans. And a lot of the times, like you said, we overlook them. So I'm excited to help moderate this portion of the webinar. Jackie, thank you so much. And Pete, for taking us through so many of the important and critical aspects of Medicare. And we're here just to make it a little bit more smoother and simple process for you. So what I'm going to do now is jump into the Q&A. But while we do the Q&A, I'm going to go ahead and put back the slide that you can reach out to us and contact us. Just take a picture of this QR code. Also, I'm going to drop Jackie's direct appointment link. Remember, there's no pressure. You can just call us for advice or information. We're here to help you sort things out. So I'm going to go ahead and jump into the Q&A. So if you see me looking to the side, it's because that's where my questions are on my screen. And we'll go ahead and go through these. And I'll also journey back into the chat to make sure I didn't miss anyone's questions. We have a really fair amount of time left. We typically can always get through these. Jackie is the expert. There's really no questions she can't answer, so you're going to be in amazing hands. The first question is from Gaetano. What's a benefit period if it's not annual?
So that's pertaining to original Medicare Part A. Again, we're used to thinking of deductibles as an annual thing. Medicare Part B's deductible, which is $288 next year, that is annual. But for Part A hospitalization, a benefit period means at least 90 days in between inpatient hospitalization. So if I'm released from the hospital today and I'm out of the hospital for 4 months, but I'm again admitted, that's the start of a new benefit period, which means I again have to meet that deductible for Part A, which next year is going to be $1,716. So if you're hospitalized twice in a single year and there are more than 90 days in between your hospitalization, you've started a new benefit period, and unfortunately, you've got to meet that deductible all over again. But for Medicare Part B, the deductible is annual. That's for medical services.
Thank you, Jackie. The next question, I don't want to butcher any names, so I'm not going to mention this name, but did the OBBB bill law change anything about Medicare? Obamacare, yeah.
So that's the big, beautiful bill.
The
Unfortunately,
big, beautiful, yes.
we don't have any of that information yet, but it's been a very common concern, understandably, especially with the government shutdown. I can tell you that every year there are changes to Medicare regardless. That includes the premiums that you're going to pay for Part B, the copays and coinsurances, as well as deductibles change annually as well. So there are always changes going on to Medicare. Unfortunately, we just don't have anything in writing yet as far as the new updated changes.
Okay, we have another question about benefit periods, but I just want to make sure we cover this. As you said, the Part A deductible is not every year, it's by benefit period. I think that you answered this, what is a benefit period? So I don't know if you want to chime in and mention anything else, but I just wanted to make sure we address Scott's question.
Yes. So again, for inpatient hospitalization, that's if you're having to stay overnight in a hospital, each benefit period means 90 days in between hospitalization. If you're out of the hospital and you're readmitted, but well after 90 days, unfortunately, you are starting a new benefit period, which means you've got to meet that deductible all over again.
And the next question, my spouse is also turning 65 soon. Is it under my work medical plan? Does he need to sign up now or can he wait to sign up?
It depends. So it really comes down to whether or not your employer coverage is considered creditable coverage. And typically that means an employer plan covers well over 20 employees. So 20 employees and up, that's considered creditable coverage, meaning it is equal to or better than original Medicare. If that's the case, then your husband doesn't necessarily need our services, but now you can always give us a call so we can go into more detail about what your employer plan costs, whether it is creditable coverage or not, and then go from there.
Thank you. And Scott has another question. I'm so glad. We love when the questions pour in. Keep them coming. Is a supplement plan better than an advantage plan?
That's a good question and a very common one. I wouldn't think of it in terms of what's better or worse. Think of it in terms of, is it going to fit my specific priorities, my needs, and my budget? Because supplement plans and advantage plans work very, very differently and their premiums can vary significantly as well. So don't think of one as better or worse. Think of it as, does this fit my priorities? Does it fit my doctors? Does it fit my budget? And that's what we help you determine when you are initially enrolling.
For Steve, if I am turning 65 while still working and have medical coverage through my employer, do I need to do anything Medicare related before I turn 65?
So like the previous question, it really depends on your employer plan. Is it considered creditable? And typically that's if your employer plan is for 20 or more employees. If that's the case, you may not need our services and you can just continue on your employer plan. But there are other factors. For example, how much are you paying for your employer plan? What are your out-of-pocket costs? And also, do you have any dependents who you need to continue covering on that policy?
Okay, the next is from somebody that it's an anonymous question. Can you have parts A, B, C, and D?
So you're going to have Part A and Part B. Think of that as the basis of your coverage. Your secondary insurance, which is going to help you fill in those gaps that A and B have, will either be a supplement plan plus a Part D plan or a Medicare Advantage plan, which is known as Part C. So you're either going to have Part C or a supplement plan and a drug plan instead.
Okay, this next question is for Renata. If you go in an Advantage plan originally, then want to switch it out for a different secondary insurance, will you then have to go through a health evaluation?
That's a very good question. And this is one we get very often, which is why I help my clients understand their future options when we are initially signing them up. Medicare Advantage plans have similar rules to Affordable Care Act plans where they can never ask you about your pre-existing conditions. So if you start off with an Advantage plan and you want to go to a new Advantage plan in the future, no, you don't have to go through health evaluations. You just have to have a valid election period, or you do the change around the annual enrollment period from year to year. Now, for supplement plans, the ones that are known as Medigap plans, they do not fall under those same rules. And those are the types of policies that can have you go through medical underwriting, which is a health evaluation, and your pre-existing conditions can actually cause you to be declined. But there are windows to enroll. Even if you start off with an Advantage plan. So again, when we initially sign our clients up, we want them to be fully aware of what their options are going to be and when they can make those decisions. But you can potentially skip health evaluations if you move from an Advantage plan to a supplement plan, but there's just going to be a limited amount of time to do that.
Okay, Deborah, Jackie will help you with this question. If both my husband, who turned 65 in 2026, and I, who turned 65 in 2029, will work past the age at which we turn 65, do we still need to contact Social Security? I suppose in order to touch base and let them know that we will still be working and having employer-sponsored healthcare past the age at which we turn 65.
That's a good question. Again, that pertains to the other two about employer coverage. Social Security doesn't actually need to be informed if you plan on declining original Medicare because you're still covered under your employer plan. But it is important to verify that your employer plan is creditable coverage before you opt to decline original Medicare Part A and Part B. When you finally do decide to enroll into Part A and Part B down the road, you'll be asked to fill out a form that your employer has to sign off on stating that you have had creditable coverage since turning 65.
And this is a really important question from Scott. You said that the best time to sign up for Medicare is my initial enrollment window. I am now 67 and have not begun Medicare, yet I have signed up for Part A. Am I putting myself at risk of increased costs for when I do go for it?
Not necessarily. It really depends on what your current coverage is. So if you have been covered under an employer plan, which is considered creditable coverage if you're working with a large employer plan, then no, you will not have incurred a late enrollment penalty. If your employer policy is not considered creditable, then yes, you may have incurred a late enrollment penalty. You can always give us a call and we can go into more details about your specific policy to help you determine whether or not you've got creditable coverage.
Okay. The next question is from Tom. Can you advise regarding existing Advantage plans, for example, Kaiser?
Yes, so this is that time to do it. The 2026 policies have all rolled out. Typically, new plans start rolling out the first day of October of each year. So yes, if you need a policy review, this is your time to do it. If you miss the December 7th deadline, that's okay. You still have another window between January and March of each year. That's the lesser known open enrollment period that'll also allow you to review and change your Medicare Advantage plan if needed.
Thank you. And James has a very valid question, which we get quite a bit, is how do you make money if they're not charged? If, the consumer's not charged?
Well, that's a good question. We're compensated by carriers. So if you enroll into a policy, the carriers compensate us. However, I don't recommend that you hesitate speaking with us just to get questions answered, because again, our first thing that we try to determine is, do you even need our services? Not everybody needs our services. For example, we're in a city with a large military population, and most military retirees don't need our services, but they still have questions that need to be answered. And I'd say to anybody, don't hesitate to speak with us just to get those questions answered. We don't charge either way.
And Jeff had the same question. So, Jeff, I hope that answers your question. And you can always call us if you need a little bit more clarity. Feel free to scan that QR code and go ahead and feel free to click the link in the chat box if you are ready to make an appointment with Jackie. And the next question is from Pamela. My question is regarding my employer offers secondary coverage. They said they offer a lifetime benefit, but not sure what it means. It's through UCSD, and I want to see the doctors I currently have.
Okay, so that's a good question. Typically, what employers mean by lifetime benefit is even after you've retired, your employer will continue to offer you insurance through like a retirement benefit. Now, it is important to know while you're still working, you don't necessarily need both Part A and Part B. Once you retire, however, and you're over 65, even if UCSD continues to provide you with retiree health insurance, you will still need both Part A and Part B at that point. But that's a very important question to ask your HR manager. Just make sure that lifetime benefit means they're going to be offering you retiree health insurance once you've retired and well after you've turned 65.
Okay, and the next question is, what are the qualifications for Medicare to cover in-home care?
So, by in-home care, there oftentimes people think of custodial care as in-home care. That's like a caretaker coming to your home to help with things like cooking, cleaning. That sort of coverage is not actually under Medicare. That's a separate type of benefit. Now, for in-home care, as in maybe you're too injured to leave and you need your doctors, your nurses to visit you at home post hospitalization or for wound care, for example, that is covered under Medicare. It just has to be deemed medically necessary by your doctor. And depending on the coverage you have, they might have to submit like a prior authorization to the plan. But custodial care for daily activities, cooking, cleaning, that's not covered by Medicare.
All right, so the next question is coming from Mark. If I currently have medical coverage through my spouse's large group employer, will they require me to enroll in Medicare when I turn 65 years of age or continue with their existing medical plan coverage?
If you have creditable coverage, no, you should not need both Medicare Part A and Part B. Just verify with your plan representative that the coverage is considered creditable.
And the next question is from Scott. Can I use Medicare in any state in the US?
Original Medicare Part A and Part B, because it's federal government, yes, that can be used throughout all 50 states as long as the provider says, yes, we take Medicare. Supplement plans, because they are paired with original Medicare Part A and Part B, are also usable in all 50 states. Advantage plans, it depends. Advantage plans are specific to counties, so typically you'll have a service area. And when you're outside of that service area, you'll have access to emergency and urgent care, but not necessarily routine doctor visits or regular doctor visits. But there are some policies, even Advantage Plan policies, that allow you to see providers throughout the states.
I'm just quickly jumping to the chat as well. Is there a cap to what can be billed under Part B, or is it unlimited depending on treatment received as a bill?
Unlimited, unfortunately. So that's the big drawback to just having original Medicare Part A and Part B. That 20% coinsurance for medical services has no cap. So no matter how expensive your medical bills are, you're going to owe 20% out of pocket.
Okay, and here's a question from an anonymous attendee. I turned 65 in October. I applied for Medicare. My tax returns from 2 years ago were used, which are an outlier to my normal income. Because of this, I just received Part A and was denied Part B. When can I apply for Part B for this next year when the tax returns to normal? I was told I could add on the full Advantage plan in January. How should I go about this? And what do I do for December?
So I definitely like to have a conversation to understand a little bit more about why Part B was declined, because there's no requirement to have 40 credits or a particular tax to qualify for Part B. You just have to have a valid election period. Part A does have a requirement to have at least 40 credits to have it at $0. Now, when it comes to income, your income can determine how much you pay for Part B and also for drug coverage. So maybe that's what Social Security meant. That's called income related monthly adjustment amount. Your adjusted gross income, always from 2 years back, determines if you're going to pay the standard rate for Part B and drug coverage. If you're a high income earner, you'll end up paying more for Part B and for D, but it doesn't prohibit you from enrolling into Part B. So I'd like to learn a little bit more about your situation to figure that out. If you're outside of your enrollment period, yes, you can enroll for Part B sometime between January and March. But if you just turned 65 in October, you're still within your initial enrollment period. Because remember, you've got 3 months after October. So that's November, December, January.
Next question for Christopher. As a disabled vet, I have medical, but not dental or hearing. Do I still need to sign up for Medicare or do I just need Part C?
So remember, original Medicare Part A and Part B is the basis of your coverage. You need to have A and B before you can get any secondary insurance, which is known as Part C, Part D, or Medicare supplement plans. If you have VA benefits, you don't necessarily need Medicare to use the VA. But if you plan on using providers outside of the VA, or if you needed those extra benefits, then yes, I'd recommend you enroll into Part A and Part B. And we can also look for secondary insurance like Part C plans that are tailored more for those who have VA benefits. You can always give us a call and I'll go into more detail about that.
Okay, and the next question is it true that Medicare does not cover cancer-related treatments?
No, that's not true. Maybe that was pertaining to Part D. So some cancer drugs are not covered by prescription coverage, but rather by medical services like radiation therapy, chemotherapy. But cancer treatments are certainly covered by original Medicare. If maybe you have more specifics on that, like a particular cancer treatment might be very new, that might not have been approved by Medicare, but cancer treatments in general are covered by Medicare.
Okay, and then going back to the question regarding if Medicare was covered throughout the US, you had mentioned that, but by travel limitation, are there issues when traveling within the USA? I plan on camping a lot when I retire.
That's a very good question. And we often ask about what your plans are when you're retiring or what your lifestyle is like when helping you determine what type of policy is most suitable for your needs. Some plans, like supplement plans, are usable across all 50 states, but Advantage plans will have a few more restrictions. If you do plan on traveling quite a bit, we'll go over the options that help you with your priorities, like accessing regular doctor visits while you are traveling. Also, some people just live between two different states, and there again are specific types of policies that are more suitable for that type of lifestyle.
Thank you. We are at the 1 p.m. hour. However, I did want to ask if we have like a couple more minutes just to maybe answer one more, Will. If we don't have the time, that's okay. We know there's a lot happening. For those that weren't able to get their questions answered, you can always schedule an appointment or give us a call.